Hey everybody, it's Dr. Hyman. How y'all doing? I got a lot of flack for a post I put up yesterday about how we have to address chronic disease and COVID in this country. And it was very saddening to me because I felt I was trying to bridge a gap and create a dialogue. And I was accused of a lot of things which really weren't factual or accurate. I just want to clear them up. And I want to sort of invite anybody to have a conversation with me about this. Welcome anybody to come on with data, science, and information. Everybody's entitled to their opinion, but you're not entitled to your own facts. And I encourage anybody who's really interested in these issues to not listen to the media, to not listen to politicians, but to go on PubMed, which is the National Library of Medicine database, and actually do some homework, do some real work. Look for yourself at the data. You can also look at who's funding it. You can look at who's behind it, of course, and there's conflicts of interest for sure in research. It's not perfect. But when you look at the massive data, it's impressive. So on this Instagram Live, I'm going to address some of the issues that were raised around my apparent sympathies with the Democrats, which is not accurate, my mask mandate support, which is not accurate, and my support of vaccines and vaccine mandates, which is not accurate. So there's a lot of assumptions made, and I just want to sort of share a little bit about my perspective on the situation we're in right now. First of all, let's just take a 30,000 foot picture. I'm willing to work with anybody at any time to work on the big problems we face. And chronic disease is really staggering. It's 6 out of 10 Americans. It kills 11 million people around the world every year from bad diet. It's driving huge environmental and climate crises, racial injustice, and creating huge economic burden for our country, far more than COVID. I mean, I think COVID's staggering, but the chronic disease burden is just there all the time, and it's getting worse and worse. We're 1 in 2 Americans has prediabetes or type 2 diabetes. So that's the background that we're facing, and it's driven by our food system. And I've written a lot about this with Food Fix. You can read about it there, my perspective. And just to be clear, I've worked across every aspect of government. I'll work with anybody and have any conversation with anyone about these issues because I care about them, and I know from a personal perspective as a physician doing this for 30 years just how important it is that we come together to solve this problem because it is crippling us. The food system is the biggest driver of chronic disease, of our economic crises, of social and racial injustice, of poor education in kids who can't learn because they're struggling on poor diets, on behavior issues, violence, and divisive behavior and disruptive behavior, which is really clearly outlined in my book about, for example, how in prisons, when they give prisoners healthy foods, violent crime goes down by 56%. And of course, even national security, we're seeing, the military not be able to find recruits for military. 70% are rejected because of poor health, mostly driven by our diet. And of course, then there's the environmental degradation of our agricultural system and its impact on climate change. It's the number one cause of climate change. So that's sort of the background, and this is the issues I care about, and I'm willing to really work with anyone. And just as an example, I worked at the Daniel Plan, creating a Daniel Plan with Rick Warren, who's an evangelical pastor from Southern California. I'm a Jewish doctor from New York, and we couldn't be more different. We couldn't have more different perspectives on many, many things and many issues, and even politics. But we worked together to solve a real problem, which was his church was very unhealthy. And we worked together in community to help his congregation lose 250,000 pounds in a year. And Rick was often chided for, having conversation with Obama or, being too left-leaning, although he was clearly very Republican. And he said, look, I'm not for right-wing or left-wing. I'm for the whole bird. Otherwise, you'll fly around in circles. And I have worked in every administration that I could. I've worked with the Trump administration. I've worked with the White House. I've worked with Republican senators and congressmen. I work with Democrats. And I'm committed to these issues. And I don't care who's in office. I don't have to have agreement with all of their ideas. And I don't, for sure, both Democrat and Republican. But I care about these issues. And I feel like it's important to really focus on the goal and not get distracted by this or that issue that might be something that I might personally not agree with. And so really we can come together and work on difficult issues that our country needs us to work on, and not have this incredible divisiveness. We can disagree. We can have different opinions. We can cite different facts. We can have different approaches to solving problems, but we should have dialogue. We should listen to each other. We should be respectful. We should honor each other as human beings. We should approach things with love and not fear. And this is really all I was trying to say. And all of a sudden I got accused of, being for the mask mandate. Well, first of all, I don't think Biden actually has said we should have a mask mandate for everything, because he's not even able to do that as president. I think he said states should have it. In fact, Utah just announced that it was going to have a mask mandate because the cases were out of control. And so what do I think about masks? I've talked a little bit about this before, but I encourage you to go to PubMed, just Google PUBMED, and type in masks and COVID-19. You will get 1,500 scientific references of research looking at studies on the impact of masks. Now, as a doctor, I'm interested in research. I'm interested in science. And I think I looked at it very carefully, and I was like, look, it's not perfect. They don't prevent all cases, but COVID's very dangerous. Why? Because one, it spreads asymptomatically. Two, meaning you can have it and not know it and be sitting next to someone and you give it to them, and they could be someone elderly or sick or at risk, and you could kill that person. So it's not just for you, it's to protect other people. Second, when you look at the data, use of masks by the majority of the population can reduce the risk of death by between 25 and 68% looking at the population. And that gets my attention. If you, for example, had your child or your spouse or your mother who had cancer and needed a bone marrow transplant, and their immune systems were shut off with medicine in order for them to be able to receive this bone marrow transplant, they're in an isolation room. Would you say it's a violation of your medical freedom when the nurse or doctor says, in order to go visit your family member, you have to put on a gown and a mask? No, you wouldn't say that. You wouldn't tell your surgeon, don't wear a mask when you're operating on me for my appendicitis. It's fine. You don't need to wear a mask. Or would you invite someone in your home who had the flu, and you have an elderly grandparent there who's at higher risk of infection and death? Would you want them coming into your house and coughing and sneezing around your grandparent? I think most of us would probably say no. And I think the goal here of masks isn't to push something that's unproven or unscientific on the population. And I get that people disagree with whether you should have it on or whether it's going to make you sick. And I just don't see any evidence for that. I really looked at the data. And I think we get so caught up in news cycles and articles on the internet and on Facebook and social media. Don't pay attention to any of that. Do your own homework. Look at the research. Make a decision for yourself. Don't be caught up in the cycle of all this misinformation. So that's just to say that I think masks are imperfect, but I do see that they have a role. And even the Dr. Redfield, who was the CDC director with President Trump, came out and said, look, using a mask is the single most important thing, maybe even better than vaccines. And I think in countries, for example, like Taiwan and Asia, they have no deaths anymore. They barely have any cases. I think there are more cases in the White House than there were in Taiwan and Vietnam, and I think one other Asian country combined, because they're used to wearing masks over there. In fact, in China, I lived there for a while, and everybody wore masks because it was so polluted. So I think just to say, let's just deal with an honest conversation about this. The other thing I just want to share about is vaccines. Now, those of you who know me know I'm not a pro-vaccine or an advocate of vaccines, but I'm also not anti-vaccine. I'm pro-science. And I think we need to understand that vaccines have a role. Now, as a physician, I've seen cases of measles. I've seen cases of polio. I've seen people with tetanus who weren't vaccinated. I've seen people who needed liver transplants from hepatitis B. I think these are real problems, and I think vaccinations have a role. Do I think they've gotten out of hand? Do I think we over-vaccinate our population? Do I think the vaccine schedule doesn't make sense? Yes. Do I think that we should be concerned about some of the additives that were in vaccines? Yes, I helped write a book about this using a platform to discuss thimerosal as an issue, which is mercury in vaccines. So I think vaccines are complicated, and I'm for safe vaccines. And I always joke and say, I'm for safe flying. It doesn't mean I'm anti-planes. So I think we need to be very smart about about vaccines, and I think there's a lot of concern about the COVID vaccine. And the truth is, if there was a vaccine that was safe, it was effective, that could stop this pandemic, and was well documented with science, wouldn't you want to maybe consider thinking about it? I mean, look at what's going on right now. We can't go visit our friends. We can't be with our families. We can't run our businesses. We are struggling, and it's crippling us. So I'm not saying I'm first in line to get a vaccine. I'm just saying we need to have an open mind. And I'm constantly looking at the studies. I'm very skeptical, and I'm asking a lot of questions. But I'm not closed-minded, and I don't have an opinion before I see facts. So I'm sort of suspended in my opinion until I really understand what the science shows. But I do believe that, on the other hand, that there are a lot of other things that are really important to understand about COVID. And by the way, I do not think we should have a mandate for vaccines. I really do not believe in that. So if people think that I've said that, I think, or I believe in that, please do not actually think that anymore. Now, I do feel like we just have an interesting moment where we can think differently about what's happening, and we can focus on the real issue, which is why are so many Americans, we've crossed 10 million Americans who've gotten COVID. We probably have thrice that or three times that, because many have not actually been tested. We've had 235,000 deaths, 250,000 people. It's a lot. I mean, COVID is the third leading cause of death now in this country. Why? Well, we are a sick population. In China, there's 3 deaths per million population. In America, there's 500 deaths per million population. And I think the reason is, if you look at our stats, the Chinese have an obesity rate of 2.6%. We have one of 42%. 75% are overweight or obese, and 88% are metabolically unhealthy. That's the issue. That's what I'm focused on. That's what I'm trying to help change in this country, is our food system, to provide a healthier food system that can actually provide real solutions to why we're so sick as a country and why we're so susceptible to COVID. It's more complicated than just our obesity. Obviously, there's how it was managed, and testing and contact tracing and various things that have challenged what's going on. But I do think that we are in a real crisis, and we have to be real about it. I mean, COVID is not a hoax. I just don't know what to say. I've been in the emergency rooms. I've been in the ICUs. I've had so many people who've got it who I know. I have so many people I know who've died from it. And I think if you're isolated and you may not be aware of that, it may seem like it's a hoax, because where is it and how bad is it? But it is. It's out there. And what's even more concerning to me is with this issue of post-COVID syndrome. Now, I just want to talk about this for a minute because it's really important. And if you're for any reason to wear a mask, this is it. I mean, because there is a syndrome that's evolving that happens like chronic fatigue syndrome after, let's say, a virus that happens. It's the same thing that's happening with COVID. And in some populations, it's up to 87% of people who get COVID in hospitals are not better at 2 months. And I have so many of my patients who have post-COVID what's called long hauler syndrome. And now at Cleveland Clinic, we have a center looking at how do we address this? How do we solve this? And I think it's really important that we take this seriously, because it's not just about, the vaccine or mask. It's about really addressing and decreasing the spread of this virus by any way we can do it. And I am terrified for our population, because think about it. If there's 30 million Americans who've gotten it, 30 million Americans who've gotten it, then what percent of those are going to get sick? Well, SARS, the first group, the first SARS virus, not SARS-CoV-2, but SARS, basically COVID, the first one, 40% of 3 years had chronic fatigue syndrome. So we are working with the Institute for Functional Medicine to look at how do we address this comprehensively? How do we help patients who are struggling with post-COVID syndrome, with prevention? I mean, just vitamin D alone is so simple, and it's not even being talked about. Although it was in the newspaper when President Trump got COVID, they gave him vitamin D and zinc in the hospital. So vitamin D, if your levels are low, you're about 80% more likely to get sick and die. And if your levels are high, you're 95% less likely to end up in the ICU. So that's just simple intervention alone. So I think it's really, really important that we we solve the problem. Vaccines are not, I think, going to be the panacea. I don't think they're going to solve this problem for us. I think we need a much more comprehensive approach. But I have to keep an open mind, and I think you should too. And a vaccine will be the last step on my journey. I think if we really have to get there, but I really do think we can solve this by taking a comprehensive approach. So I'm going to work with whoever is out there. I've worked with the Trump administration. I've worked with senators in Congress, Republicans and congressmen who are Republicans, Democrats. I don't care, and I think we shouldn't be so polarized. This is what makes me so upset. I mean, I'm a doctor, and I don't say, well, you're a Republican, you can't come in my office and see me, or you're a Muslim and I don't treat Muslims, or you're Jewish and I only treat Jewish people because I'm Jewish. I mean, it's crazy. I treat whoever's there, and I give them the same care, attention, and love, whatever race, color, nationality, sexual preference they have. And I think that's how we should treat each other. We're humans first, and whatever our beliefs are second. And we can honor that, and we can honor our disagreements, we can honor our differences, and we can still get things done. So that's what I'm hoping, and I'm hoping we stop this polarization. I'm hoping we have an honest conversation, and I really want us to sort of move into a state of solving our big problems, because all these back and forth conversations are just a distraction. They really are missing the point. We are a sick nation. We need to deal with it. So I'm really glad that you listened. I hope it made some sense to you, and I think we just need to go forward and work together and choose love over fear. So thanks for listening. And by the way, if anybody wants to do an Instagram Live with me, if anybody wants to talk to me, who has data and science, and we can have a real conversation, not opinion, but data and science, and wants to talk about it, I'm up for it. I'm up for any conversation, and I want you to come with data that you get from PubMed, because that's really all it counts. Not the news media, not the internet, not Facebook, not Instagram. Look at the data, because that's what we should have a conversation about. And we can debate the data. And I debate the data all the time with scientists, but it's with love. It's with kindness. It's with integrity. It's with curiosity. I'm interested to know, why do you think that way? You're a genuinely smart person. You seem like a kind human being. You care about your family. You love your community. You want to make the world a better place. Why do you believe what you believe? Let me find out. Let me ask you some questions instead of making you into the enemy. We're not enemies. We're all humans, and more than ever, we're all in this together as a human being, collective population in the world. So anyway, take care, everybody. Have a good night, and hopefully we'll go ahead and have the conversation ongoing.